Hello, I'm Dr. Sundari Mase, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in our county with you. Here is my report on cases as of yesterday, August 4th. We had 3,208 confirmed cases, up 95 cases over the weekend. 1,547 are active, 1,619 have recovered, and we have had a total of 42 deaths, with 3 more deaths reported since yesterday. We've now done 75,381 coronavirus tests, and 318 of those completed since we last spoke. So today I want to talk a little bit about the data and surveillance issues that we have been having. Some of you may have noticed recently the reporting hasn't been as quick to update as in the past. The California Department of Public Health has discovered that there's been an underreporting of COVID-19 cases due to technology issues with the electronic laboratory reporting system, or the ELRS. However, patient care and test results have not been affected or delayed by this issue. While clinicians are still able to report to respective local health departments, including ours, this issue may impact our ability to receive all the lab reports in order to investigate cases and contact trace to the extent that we've been doing and as quickly as we've been doing. We will report the basic data that we do receive directly on the COVID-19 page on socoemergency.org, but not to the dashboard until this issue is resolved. We want to be really accurate about the data that we're putting on the dashboard. So the state has taken the following actions to address this issue. They have deployed a team from the Department of Technology to assess the underlying code. They've engaged the local public health officers to ensure that they have the necessary information. And they've instructed all laboratories in California to manually report all positive cases to local public health departments in order to make sure that patients are being notified if they're positive as quickly as possible so that they can be isolated and so that their contacts can be identified and quarantined. Hopefully, these actions will remedy the issue swiftly so our public can stay informed. Additionally, I'd like to remind everyone that if they get tested and they are notified that they're positive, that they are required to tell their close contacts to quarantine and also to get tested. It is even more important given the data reporting delays from the state I just mentioned. So if you do find out that you're positive for COVID, please isolate, get a hold of all of the people you could have been in contact with, and tell them that they need to quarantine and to get tested. It's been noted that the board is considering a new civil compliance ordinance. As soon as we know more about this, we'll deliver that messaging to you also. So today's community question: what's the latest update on wearing facial coverings? I walk early in the morning and rarely see others. If I do, we pass each other, always respecting the 6 feet of social distancing. Do I need to wear a facial covering under these circumstances? You do not need to wear a facial covering if you're able to maintain 6 feet of distance outdoors. Though I recommend to always carry a facial covering of some type, even if you are alone, you may encounter others when outside your home. So have that facial covering with you and ready to put on if you cannot socially or physically distance to 6 feet outdoors. Facial coverings are an effective way to prevent the spread of the virus. And if you're indoors at any time, in grocery stores, pharmacy, healthcare facilities, then you really should wear the facial covering at all times, whether you're able to social distance or not. So have a safe day, everyone. Talk to you again next Monday.